I'm Dr. Jimmy McKay, and I'm your host. Today, we're talking about kidney health. Audience, remember, if you have a question or comment during a live stream, feel free to drop in the comments below on whatever platform you're watching from. To make sure you know more about kidney health is the chair of urology at Mount Sinai Downtown and director of minimally invasive surgery for the Mount Sinai Health System. Let's bring him in, Dr. Michael Palese. Dr. Palese, welcome to Mount Sinai Live.
Thank you so much. Thanks for having me.
All right, let's get into kidney and learning more about it. What are some of the most common kidney problems that you see?
So, kidney problems is sort of a very wide-ranging term. The doctors that take care of kidney problems are actually twofold. There's urologists like myself who deal with a lot of these surgical issues, and then there are the nephrologists who deal more with the medical issues. And so why I make that distinction is because quite often, depending on what your problem is, will determine which doctor you'd want to see. We work together quite often together. So many of my nephrology colleagues will send me cases that we work together regarding, trying to figure out what's best for the patient. But in terms of the types of problems you can have, the most common things that people have are what's called chronic kidney disease or chronic renal insufficiency. This is when the kidneys themselves don't work as well as they're supposed to. This can be due to a number of different problems that we can talk about a little bit later, but that's one large category. One area that I specialize in is kidney stones. So that's obviously a big part of when people talk about kidney problems. So quite often patients will see me for an active kidney stone issue or for prevention issues. They also see my nephrology colleagues for dealing with some of the medical sides. You can also have intrinsic kidney issues like glomerulonephritis, which is sort of an inflammation or inflammatory condition of the kidneys themselves. People can also obviously have cancer. These are conditions that I would generally treat, whether it's surgically or manage them medically. Work sometimes in conjunction with a radiation oncologist or a medical oncologist as well for these types of problems. Another condition known as polycystic kidney disease or renal cysts. This is where people have a lot of cysts develop in their kidneys. These can be genetic, these can be acquired. And so obviously these are a lot of patients that I will often see as well. And then finally, one of the other categories is sort of obstruction or anatomic reasons. People are born with kidney problems, born with kidney obstructions. And quite often these are things that are birth defects that need to be fixed, whether as a child or even as an adult. And so quite often these are problems that I will fix as well.
So you started to answer a little bit of my next question, but are some people more prone to kidney disease than others?
Absolutely. And so, kidney failure in particular is one of the big things that we have to contend with. Patients that are prone to this are patients that have diabetes, the elderly, patients with high blood pressure. And obviously there's also a genetic component that runs in the families. So patients, and obesity, of course, too. So patients that are kind of fall into any of these categories, whether it's a combination or a 1, 2, or 3 of those things I just mentioned, they all can lead to kidney problems or kidney failure. And so most of the time we're trying to combat that by having patients lose weight, watching their blood pressure, making sure they're eating healthier. These are all absolutely, musts for longevity in terms of renal the ability for the kidneys to work properly.
All right, so I love busting myths. So when you get told something by a friend, you want to see if it's true. Since we've got you here and you're an expert, if I go to the bathroom frequently, does that mean my kidneys are not working properly? Settle this one for me.
So it's a great question. So, the reality is that the kidneys don't really have much to do with the frequency of urination. They can, in the sense that if you're making more urine, you'll obviously have to go to the bathroom more often. Generally, frequency or urgency, we call it, is when you're running to the bathroom more than you should, whether it's every half an hour, every hour, is due to issues that can be related to either the prostate or the bladder itself. Prostate is a condition where you can have an enlargement that leads to pressure back on the bladder, so it's something known as BPH. So a lot of men will obviously experience that in their lifetime. Prostate cancer is another one. prostatitis, which is inflammation of the prostate. These are three main conditions that are prostate related that can also then create these conditions of frequency and urgency. In women, quite often infection or inflammation can lead to urgency and frequency. Overactive bladder, which I'm sure many of you've seen sort of out on TV. There's lots of commercials now about different types of medications you can take. Also very common to see as well, especially in women, but it can also happen in men too.
Here's another common question. You get asked this sometimes at a doctor's office, sometimes if you're in a hospital setting. What color should urine be? Can urine color indicate if there's a situation going on?
Great question. Yeah. So just like anything else, I mean, the color of your urine can indicate a lot of things. In general, just the how white or how yellow it is can indicate your dehydration status. So that's it's not really a myth that obviously the more hydrated you are, the whiter sort of the urine will look. But different changing colors can also mean different things. For instance, if it's red, it could be blood that you're seeing there, which can indication that maybe you have an infection or something more serious going on, like a malignancy. It can also be sort of more of a brownish color, indicating whether you have protein spillage or other issues going on. Old dried blood can turn sort of a brownish color. So no question the color of the urine can be helpful. If it's gray or cloudy, could indicate an infection. And so these are things, no question, when you see your physician, you should be describing what the urine actually looks like. And so if you notice it coming out, it looks a little strange, something you should probably tell your doctor too.
Yeah. Noticing a difference, definitely bring that up. You mentioned kidney stones earlier. Let's just settle this. Causes of the condition. What are the causes of kidney stones?
So kidney stones are actually very common. There is always a hereditary component, meaning that they can run in the families genetically. Can be passed on from generation to generation. But the most common reason for people getting kidney stones is probably dehydration. So it's not an old wives' tale that you have to sort of drink more, that you need to sort of keep your kidneys hydrated, because there is something to that. One of the things that I see in my own colleagues, especially with surgeons, is that they're quite often will develop kidney stones over time because they're not drinking a lot of water. They're going to the operating room all day, and so it's not an uncommon thing to see that. There is some components, obviously, with it can be diet, specifically calcium, oxalate, sodium levels that can contribute to kidney stone formation. Uric acid levels, so particularly patients where they're afflicted with gout can develop kidney stones and those uric acid stones. So there are other reasons to get stones, but number one is really going to be the hydration status over time that can lead to deposits or calcium oxalate deposits that are being left behind in the kidney, which then lead to kidney stones themselves.
Let's talk kidney stone treatment. What's available? What's out there? What's new?
So the good thing about kidney stones is there's a lot of treatments that are not available, certainly minimally invasive. In the old days, we had to do these big incisions to get to a stone. Nowadays, there's many different ways to do that, whether we do it through shockwave treatments where we send sound waves to the body to actually break up stones. We also can look in, or just like plumbing, go in through into the urinary tract and pluck out a stone or laser it and break up the stone that way. Sometimes we'll do that from below, or other times we'll actually do it directly through the back through what's called a percutaneous approach, going directly into the kidney itself. I also specialize in an area called robotic surgery. So particularly if they're very large stones, we call them staghorn calculi. These are stones that just basically are completely basically involving the entire inside of the kidney. Sometimes actually going in and just making a small incision in the kidney makes a lot of sense. Just pulling it out. It's a much quicker, much safer approach and gets the patients back on their feet much quicker.
Okay, so you alluded to this a minute ago, but let's make sure we're nice and clear. Avoid getting kidney stones. How can we make sure our audience avoids getting the kidney stone in the first place?
So no question, hydrating well is important. If you're already prone to kidney stones, whether it's when you're exercising or when it's hot outside, and if you're noticing that there's going to be increased losses, hydration losses, no question you want to step up your game with drinking water. And again, water is probably your best friend, more so than juice or sodas and coffees, teas, such things. You have to remember a lot of these things do carry extra solutes in there that can lead to more kidney stones. Alcohol, caffeine can cause more dehydration. So really water is your best friend. One of my patients, when they have kidney stones, I recommend a little bit of lemon juice in there. There's naturally a substance called citrate in there that can protect against kidney stones as well. And quite often we'll actually supplement patients, having them take medications with citrate in it to protect them from kidney stones too.
As New York Bravest go by the office there with Dr. Michael Palese. We appreciate that. Let's talk about pain and identification. How do I know if the pain that I'm feeling is actually from kidney stones? When do I know to go to a medical provider?
Kidney stone pain can come in many shapes and sizes. Generally, it sort of starts in the flank area in the back, and then starts to radiate down towards the belly button or the umbilicus. This can change over time depending on where the stone is situated at the time. And you have to remember, it's not really the stone that's causing the pain. It's actually the backup of the urine, or what's called colic, or so the distension of the kidney and the ureter that then leads to the pain. So, just having the stone doesn't always lead to pain. It's when it actually falls and causes an obstruction and causes a backup of urine that's actually what you're feeling. So best answer for what you're asking is, if you're having pain and it's unbearable, well, best things do get seen right then and there.
Yeah, always see a qualified medical provider right there. Why are some people more susceptible to getting kidney stones? We talked about dehydration, but are there other reasons that certain people might be more susceptible?
Yeah, so obviously we talked about some of the genetic factors and some familial factors. Dietary changes can also be part of that. So quite often patients that a vegan diet is a classic example where you'll increase the amount of oxalate and calcium that's being eaten, and then what happens is, of course, that can build up sometimes in the kidney and lead to kidney stones. And so, one of the first things that we talk about is moderation and avoiding certain foods that have high levels of oxalate, high levels of calcium, high levels of sodium, because these are all things that can lead to more kidney stones. It doesn't mean that everyone has to worry about this. Just people who are prone to getting kidney stones should probably take that into precaution and take that into their lives going forward, and being careful what they're putting into their bodies.
Before we let you go, any final thoughts on how to maintain your kidney health? Anything else you'd want to add?
So no question, all the things that we talked about, maintain your blood pressure, watching your weight, watching your diet, making sure you hydrate well, make sure you see your primary care doctor on an annual basis, that we monitor your kidney function overall. If there's any family history of kidney problems, whether someone's been on dialysis before, so meaning that their kidneys don't work at all, these are people that need to be monitored regularly, and we definitely recommend them seeing their doctor on a regular basis.
Excellent. Dr. Palese, thanks so much for your insight today. Find us at Mount Sinai NYC and all major social platforms. This has been another Mount Sinai Live broadcast. We stream smart healthcare information that's simple to understand so you can improve your health. I'm physical therapist Dr. Jimmy McKay. Thanks for watching.
Thank you so much.